Hello and welcome to Lancet TV. I'm joined now by Professor Yvonne Ryden from UCL Bartlett School of Planning. Hi Yvonne, thanks very much for joining us.
Welcome.
So to begin with Yvonne, how are our modern cities developing globally?
Well, it's an often quoted statistic that over half the world population live in cities. That's about 3.4 billion people. But we also need to recognise that this number of people in cities is really growing quite rapidly, and that we could be in a position of 6.3 billion people living in cities by 2050. There's a couple of features about that. First, a lot of that growth is going to happen in lower income countries, in Africa, in parts of Latin America, say. A lot of it's going to be in smaller and medium-sized settlements. And a lot of that is going to impact on the very poorest of the poor. Currently, we already have 1 billion people living in slum-like conditions, and that could grow to 2 billion within a couple of decades. So we've really got a task ahead of us to try and make these places livable and also healthy places for the world's population.
And how is the rapid growth of cities impacting on health?
Well, we know that city conditions make a big difference to the well-being of their residents. There are things like the amount of sanitation that's provided and the provision of clean water. That's absolutely basic for the poorest people globally who live in cities that just don't have access to improved sanitation or clean water supplies. But there are other aspects as well. There are issues to do with external air quality and indoor air quality. We're more commonly focused on external air quality to do with traffic and industry, such as affecting big cities in China at the moment. But there's also issues to do with indoor air quality. And it's estimated that about 1.5 billion people a year are adversely affected by poor indoor air quality due to using unclean fuels for cooking, essentially. Then there are issues to do with mobility around the city. We live in cities so that we can travel to shops and services and workplaces, so we're very mobile within cities. But a lot of that mobility is actually either done in very unsafe ways, immediately unsafe ways, like walking in low-income countries where there may be potholes or no safe access across busy roads, or in cities like London where we tend to use car and sedentary forms of transport, and that has an impact on our health through us not being mobile enough, becoming obese, affecting our heart conditions and things like that. So there are whole issues about active mobility. Then there are issues to do with combating the urban heat island. Some cities are going to face increasing heat stress due to climate change. And our cities aren't always well planned and designed in order to combat that. So we need to think about how we could put green and blue infrastructure into cities to make them more thermally comfortable places to live in. There are issues also to do with mental health. Do we have cities that actually are conducive to mental well-being? And again, greenery is very often to play an important part there. It's the whole variety of number of ways in which we plan and design and build our cities that impact on the health of residents.
Now the Lancet and UCL have set up a joint commission to investigate these issues. What are your recommendations?
Well, our key point about the Commission is that we argued that in order to actually understand what's going on, and more importantly to deliver better urban health, we need to recognise that cities are very complex systems. Now, what that means isn't just mean it's complicated. It doesn't just mean that health outcomes are the result of lots of different factors. It means that it's very difficult to isolate particular things that cause urban health in urban populations. Urban health outcomes is a result of a number of factors working together. It's a result of, it's very difficult to differentiate cause and effect because effects become causes of yet further health outcomes. We have a lot of unintended consequences of interventions in urban health, and we very often have outcomes that we don't expect and don't particularly want. So when you recognise that cities are these complex systems that have to be understood in this way, then you have a very different way of thinking about how you develop policy to promote urban health. And one of the things we recommend is that you need to have active coalitions of stakeholders coming together to build a political agenda for urban health. But then you also need these stakeholders working together on particular projects rather than emphasising sort of strategy development per se. I mean, it's a good idea to have an urban health strategy, but we want to go beyond that to the implementation stage And that means bringing together selected stakeholders to actually develop projects that will try to improve the urban health of specific communities. So let me give an example to make that a little bit clearer. It may well be that in particular localities, what one wants to do is to promote a project that is going to take a space and is going to green it and is also going to use it for urban agriculture. Now, that has a number of benefits. People working on that space to grow their food are engaged in very active exercise. So that's very good for their health. If you're working in a low-income community where perhaps it's difficult to get access to cheap fruit and vegetables, that might be a way of actually improving the diet for some of the most vulnerable sectors of the community. And thirdly, when you have something like that happening, you're creating greening, which has benefits to do with the urban climate and to do with urban pollution very often. And you're also providing a focal point where people can come together to work together. And that helps build a community, helps build what we call social capital within that community. And that makes a more resilient community, which is another way in which they can actually become a healthier community as well. So fostering those kind of projects is really important. But having said that, it's not just enough to have lots of projects happening. We need to know which ones are successful and which are not, and why. So we're also promoting the idea of evaluation of these projects, and these projects learning from each other, what's called social learning in the jargon. And again, that is not just a matter of getting consultants to come in and measure what's happened, but it's a matter of finding out what's happened and then communicating, building the dialogue within the stakeholders so they can learn by doing within these projects, and then between projects people can learn from each other what's worked in one place and why, how it was related to particular features of that community that might not work quite so well in another city. So we're trying to recommend this different way of doing policy, which is very project-based, very experimental-based, and very much emphasising evaluation and learning through communication between stakeholders.
And what would be the dire consequences if we continue to ignore these issues and not do anything?
Well, there's no doubt the people that will actually bear the burden of continuing urban ill health are the poorest of the poor. We also have a very strong thread within the report, which is about health equalities and about the need to recognise that it's the poor who actually bear the burden of communicable and non-communicable disease in cities. And we also emphasise that that is true in all cities across the world. So, in the poorest countries, you will find a wealthy elite that actually have quite good health outcomes. But the poorest will be living in these slum-like conditions very often without adequate sanitation and water. But in developed countries as well, even though the average level of health may be higher, again, you're going to have a divide between the poor and the rich in terms of health outcomes. So we need to address these health issues in cities in order to ensure not only that health outcomes in general improve, but the poorest of the poor do not continue to bear disproportionately the burden of ill health.
Professor Ryden, thanks very much for joining us.
You're welcome.